Now see how beautifully the child is sitting in the hands of the father without having any covering and smiling also. And now the mother is very much concerned about the black spot which is there on the left leg, which has no clinical significance. And whenever we say hello, how beautifully the child is smiling. This is how the homeopathic system of medicine is working each individual. Okay, the main aim which I put this particular child in this seminar is, just 1 year before, one article was there in Gulf News severely criticizing homeopathic system of medicine as rubbish or placebo therapy. You just imagine what placebo effect is there in a particular child of 6 months old. What placebo effect is there? This is how homeopathic system. So never blame homeopathic system. There are failures with homeopathic system of medicine. It's not the homeopathic system of medicine which is failing. It is the homeopaths like me are failing to come to a correct medicine. Okay, let us go with the second case. This is a case of a dermatitis and allergic rhinitis. It's a child of 7 years old. Came to me with itching eruptions in almost all over the body, especially on the joints. Dr. Ehab has already told you that in children this will be on the fleshual aspects of the body. This is the nature of the child, you see. It was completely wet. The whole leg was completely wet. And this child was a daughter of a staff nurse who is working in the reputed hospital in Abu Dhabi. So first, whenever the girl attained 4th month of age, itching starts on the popliteal area, and again this one begins to spread. So what they did, they went a dermatologist, they give some external application. It has gone with that steroid treatment with the aggravation of respiratory complaints. So every time whenever this respiratory complaints come, they will go for nebulizations or antibiotics. That will come down. Again the skin eruptions come. Again they will apply something. So this cycle was going on since 6.5 years. At the 4th month of age it was there. Since 6 years they were continuously treating this child for allergic rhinitis and dermatitis. So the observation which I did in this particular case is, a child of 7 years old, whenever they came to a doctor who is new, definitely that child will be a little bit timid. They won't come up openly. In this particular child, whenever she enters the cabin, she is running to me and explaining, "Doctor, I am having this, and I have done this much of treatment." Everything she is explaining. So I consider this one a socially active child. It mingles with everyone easily. And the second one, she doesn't sit for a single minute. She is going there. Is taking this one from my table, opening my cupboard, everything. So the child is restless, won't sit in one place. And the third characteristic feature is, she is very much destructive, because every time she will beat her brother, along with she is destructing the toys which they are giving. Within half an hour, whenever they purchase one new toy, within half an hour she will destroy that one. And she is very much aggressive with the mother and father also when she gets angry. So destructiveness is there. Desires so many things. When refuses, she makes her angry. This is another rubric. And even though this much of extrovertedness is there, she is very much feared to sit alone. There must be someone along with her. These are the peculiar features which I found in this particular child. The other parameters were as normal. The thermal reaction is chilly, sweat is moderate, thirst is increased, and the family history is, father is having allergic rhinitis and dermatitis, mother is suffering from repeated attacks of sinus infection, and the brother is also suffering from dermatitis. Yeah, just more than that. And the rubrics. Then the repertory language is extroverted. This is the language socially active child. The child is mischievous, never sit in one place. Capriciousness, this is the language which is there in the repertory. And the third one is company desire for aversion to solitude. And the general two symptoms, skin eruptions, eczema moist, skin eruptions itching. And the medicines covered were lachesis, arsenicum album, nexomica, phosphorus, lycopodium and pulsatilla. So from these, I already related lachesis, lycopodium and pulsatilla because they are hot remedies. Then comes arsenicum album, nexomica and phosphorus. One extra peculiar feature in this particular child is extraordinary fear of cockroaches, which is seen in only one medicine, that is phosphorus. Extraordinary fear means the mother told me whenever the child sees a cockroach which is there in the next room, immediately begins to shout and cry. So I prescribed phosphorus 200 for this particular child, and this child took nearly 1.5 years to get recovery. The other thing is, as her mother is a staff nurse, she cooperated very well. She knows the effect of homeopathic system of medicine and she cooperated. Even though the the girl is itching at night, she put some gauze all over the body to avoid the injury which caused by the itching. So she suffered. After that, you see the nature of the child. Okay.
Bring the mouse down.
How beautifully that this is got relief with phosphorus 10m only. Phosphorus 200 I have given, phosphorus 1m given, and at last with phosphorus 10m she is absolutely fine. Now, so this I hope phosphorus and silesia might have cleared the filaggrin protein which was deficient in this both child, and that's the reason most probably why this one has reduced, and no itching, no rash and no irritation was there in child. This shows that if the medicines which we are selecting is right, that will go deep inside the human body and will heal from internally without having any side effect. This is the beauty of homeopathy. Thank you very much.